Hello, my name is Jenna Carthy, and I will be discussing the nursing care of a patient with familial malignant melanoma. During this presentation, we will be discussing a disease overview, nursing implications for a patient with malignant melanoma, what the ABCDEs of melanomas are, disease prevention, treatment options, some nursing diagnoses to consider, and populations at higher risk for developing malignant melanomas. Melanomas are a type of skin cancer that results from uncontrolled cell division of the pigmented epidermal cells. Usually this presents as a benign growth of a mole, a birthmark, a wart, or a scar, but most commonly moles. Familial malignant melanoma is a term referring to families in which two or more first-degree relatives, such as a parent, a sibling, and/or a child, have a melanoma cancer. Overexposure to sunlight is the major contributing factor of skin cancer, although other factors are associated. These factors include genetic predisposition, excessive exposure to UV light, and the presence of one or more unusual moles. This information is important because while malignant melanomas only represent 3 to 15% of skin cancers, they're also responsible for 75% of skin cancer deaths. 10% of those cases have a family history of this disease. So let's take a look at malignant melanoma. So here is an example of what a cancerous mole might look like. Later we're going to talk about the ABCDEs of melanomas and what specifically about this mole you'd want to take note of. But before we get into that, I want to show you an example of what you'd be looking for. Nursing implications are going to include education on how to identify an abnormality. In the next slide, we'll discuss the ABCDEs of melanomas. Nurses will not diagnose a melanoma, but we should be teaching our patients, especially our patients with a family history or other high-risk factors, to be doing self-skin checks on a regular basis. This is looking for changes in the size, shape, and color of moles, birthmarks, warts, and scars. I personally would recommend a full body check after getting out of the shower at least once a week, similar to how patients are educated on doing self-breast exams. Now, furthermore, high-risk patients should schedule appointments with dermatologists every 3 to 6 months, and high-risk children should start being checked regularly starting at age 10. Also, patients who see a chiropractor regularly should inform them to be on the lookout. Chiropractors are a great resource because they generally see patients on a recurrent basis and are educated in what factors to take note of. Now, I want to take a minute here to look at the ABCDEs of melanomas. This is a tool that you're going to use when looking at your skin, doing your self-skin examination or an examination of a loved one. You're going to look at A, the asymmetry, B, the border, C, the color, D, the diameter, E, the evolution. And I like this chart because it also includes the ugly duckling sign, which is just a lesion that stands out as different from all of the others. Now let's take our tool, the ABCDE tool that we just learned, to go over that same malignant melanoma picture we had looked at earlier. And if we use this tool, you're going to notice that A, this mole is not symmetrical. If you were to draw a line down the middle and compare one side to the other, they wouldn't be mirror images. B, the border of the mole is irregular. It's not smooth. C, the color has multiple pigmentations within it. D, the diameter here is unclear because the picture doesn't have a scale, but we know to take note of lesions greater than 6 millimeters. And E, the evolution here in this picture is also unclear because we can't see 1, 2, 3, the evolution of it, but we know that changes in features over time are a sign to go see the doctor. Surgical treatment is going to be necessary to remove affected tissue once a melanoma has been diagnosed, and this surgery can range from a small local removal of a lesion to a large excision of skin and underlying tissue, and that's really just going to be dependent on the extent of damage and the spread of the malignancy. You can see here under surgical options that really ranges from a liquid nitrogen, burn of the affected area, all the way to the wide excision, which is the deep skin resection. For non-surgical options, that's going to be your drug therapy, and that's going to include chemotherapy. It can be a topical chemotherapy cream, a systemic chemotherapeutic agent, self-injected interferon infusions, which I find really interesting, oral targeted chemotherapy, and radiation therapy. When working with a patient who has been diagnosed with a malignant melanoma, there are some nursing diagnoses to consider. This is not nearly all-encompassing, but some that I wanted to include are disturbed body image, fear related to death, anxiety related to unknown long-term health status, ineffective health maintenance related to deficient knowledge regarding self-care and treatment of a melanoma, acute pain related to surgery, chronic sorrow related to disturbed body image, ineffective coping, grieving, risks for compromised resilience, powerlessness, and increased risk of infection. And you'll notice here there are many that have to do with the physical aspects of a cancer diagnosis, but a lot of these have to do with the emotional aspects of a cancer diagnosis, and that's really where a lot of the nursing care, in my opinion, is going to take place. While familial history significantly increases one's risk for skin cancer, overexposure to UV rays is a major contributing factor, with other factors being associated as well. Now, as mentioned previously, risk factors include genetic predisposition, like a sibling, child, or parent having melanoma, as well as excessive exposure to sunlight and one or more abnormal skin lesions. Other suspicious features include sudden changes, changes over time, new itching or new bleeding of a mole, and these would all be reasons to go see a doctor. Prevention is key. This is what we need to be teaching our patients. Do your skin checks. See your dermatologist. A huge piece of advice is to properly use sunscreen. This includes on cloudy days. Ohio people, take note. You want to teach your patients to choose a broad spectrum sunscreen because it protects against both UVA and UVB rays. You want it to be water resistant and have a sun protectant factor, an SPF, of greater than 30. This should be applied every 15 to 30 minutes before going outside and should be reapplied every 2 hours or every hour if you're swimming or sweating. Patients should also be using a lip balm with an SPF of greater than 30. Additionally, we want to generally be limiting sun exposure. We want to be paying attention to the UV index every day. And normally you can find this on the weather report on the news, or if you're not watching the news, you can check on your phone right underneath where it says how hot or cold it's going to be that day. There's also a weather, or rather an air report index and the UV index, and that's where you can find that. We want patients to know that reflective surfaces of water, snow, and sand also increase the risk of getting burned. We want them to be wearing protective clothing, protective glasses, and then also, and this is incredibly important, be aware of your medications that are going to increase the phototoxicity for patients, because they need to know when they're at a greater risk of being outside and getting burnt. And again, like we're told since we're tweens, do not use the tanning bed. Special populations who are at risk include people with fair skin, freckles, sun sensitivity, and difficulty or inability to tan. It's also more common in people with blue or green eyes and blonde or red hair. There's also research now correlating melanomas and the elder population who were overexposed to strong sunlight for at least one summer in their youth. So why is all of this information important? Let's talk about the survival rate. These statistics show exactly why vigilant skin checks and early detection are incredibly important. You'll see that at stage 0, there is a 98.9 10-year survival rate, but by stage 4, there is only a 7 to 19% 5-year survival rate. This is why we, as nurses, need to constantly and repetitively be educating the people that we're coming in contact with. Thank you for listening to my presentation. I hope you learned something valuable.